Hey everybody, how's it going? Dan here on Drum Talk TV with doctors Michelle and Eric, our audiologists, and I'm real excited about this because it's our second episode. We're doing these once a month for now. And, you know, as musicians and even just concert goers, or if you hang out at clubs, or even, gosh, I remember this restaurant my wife and I went to once in Mesa, Arizona, where we were living before we moved up to the rim of the volcano. And the music was so loud, we just left. And it wasn't even a club, it was a Thai food restaurant. So must have been for the kids or something, but it was just like, I can't even think. So we bailed. But doctors, what are we covering today?
So I think one thing we can talk about today would be symptoms of hearing loss. And if you struggled hearing Dan's intro with the music in the background, that could be a symptom of hearing loss.
There you go. And we will also take I'll take the questions. They will answer them.
Absolutely. We'll do our best.
Great. So I'm sure people are saying, well, the symptoms are obvious if I have to keep asking people to repeat themselves, but I'm sure there's a lot more to it than just the common stereotypical symptoms, right?
It's surprising. There are actually a lot of different symptoms that people might think that are individual, but they actually could all be correlated. So hearing somebody say, well, my husband mumbles all the time. I can't hear what he's saying, but it's because he mumbles. Or I can't hear my TV, but the audio is just not very good. Or I can't hear in background noise, but it's because the noise is so abnormally loud. There could be different environments that are all representative of the same symptom of hearing loss, but they're projected onto external factors like somebody mumbling or being a soft-spoken person, that the person may not be in tune to the fact that it is actually their hearing that is the root of what their symptoms are.
Well, I have a question about that. Is it possible that conversely, the person who's being accused of mumbling is the one with hearing loss and they hear themselves but don't realize they're not speaking loud enough for other people?
So I would think that would be unlikely because if you have hearing loss, typically, and we could get into some technicals about the types of hearing loss because that could have an effect here. But the most common type of hearing loss that your listeners will encounter will be either age-related hearing loss or noise-induced hearing loss, which present similarly. And oftentimes in those instances, people will speak louder because they have to speak louder to be able to hear themselves at a level they think is comfortable.
Interesting. And you mentioned age. At what age are people, without being exposed to jackhammers, drums, just on average, the average person, at what age does it seem to naturally start to deteriorate? Is it around 40? Is it 60?
I wish there was a clear-cut answer for that, because it would help us all know when it's important to start doing hearing screenings. A lot of it likely would be affected by your genetics, your natural body, your environments. So we see plenty of 50-year-olds that have normal hearing, and we see plenty of 40-year-olds that don't, and that start to exhibit symptoms of hearing loss. So that's why it's always good to start getting checked earlier in your late 20s or early 30s, especially if you have a family history of hearing loss, because you just don't know what kind of genetics can affect that. People say that their parents wear hearing aids, but they didn't start wearing them until their 60s, 70s. It doesn't mean that they started getting hearing loss in their 60s or 70s. It just means that they started doing something about it by that point, but that the hearing loss could have developed earlier.
Got it.
Actually, I want to add something on that that I think is really important. A distinction I like to make with my patients is hearing and hearing loss versus the functional impact of your hearing. And what I mean by that is somebody could come in, we do a hearing test, we test 10 different frequencies, and we say, your hearing is normal. But the patient's coming in complaining about struggling out in the world. They don't feel like they're hearing well. They're asking for repetition. That then comes to the question of what is the functional impact? So there's a range of normal hearing. Perhaps your hearing shifted from higher within the normal range to lower within the normal range, and that's impacting the way you perform out in the world. I've noticed in myself started in my late 20s, early 30s, I struggled in the presence of background noise. I had difficulty separating out what I wanted to listen to from what I didn't want to listen to when I was in noisy places like a restaurant or at a sporting event, places where there's a lot going on.
Yeah.
So that's a conversation I like to have with my patients, that even though on paper you might have normal hearing, you can still be negatively impacted out in the world.
That is a daily struggle for me as soon as I leave the house. Like even at the market, talking to the cashier, just any extraneous noise or ambient noise at all interferes with the clarity of. I've gotten really good at reading lips in like 4 languages.
And if you were my patient and you presented that environment to me,
Yeah.
I would say to you, typically checkout lines, there's multiple lines that are within earshot of you. You
Right.
have equipment that's making noise. You have people near you that might be loading things onto the conveyor belt. You have carts that can be rolling by. You tend to have hard floors in those environments. A lot of places like a department store, a Target, Walmart type place are going to be high ceilings.
So
So
reverberation is a
you
fact.
have reverb, you have a terrible listening environment that is going to adversely affect your ears and the way you perform. That if you took that conversation with that cashier into a quiet living room, you might hear them just fine. But when you take that conversation out to a noisy environment, it becomes incredibly challenging. That's because hearing loss affects you differently in different environments.
Very
And
interesting.
Dan, I'm curious, when you're at the market and you're by the cashier, do you ask the cashier to repeat themselves, or do you smile and nod if you're not sure what they said?
I'm not shy about asking people to repeat themselves. And to give an example, and he'll probably see this episode, a good friend of mine, Ruben, is a great guitar player. He's more than half my age. He's in his 20s. And we played a benefit show for our area because of the flooding last Saturday. So we drove an hour and a half or so to the venue, spent the evening together, drove back. I think I asked him to repeat himself almost every other thing he said, even in the vehicle on the way down there, because he's somewhat of a soft talker. That coupled with my hearing impairment, it made it so difficult. I finally had to say, you've got to speak louder, please. This is like, I'm embarrassed. I keep asking you to. So I'm not shy about that. And I don't think people should be, because you don't know what you might be smiling and nodding to and agreeing to. And you can bet I always ask my wife to repeat herself because of that. There's a liability involved there, right, Michelle?
Oh, yeah.
And you mentioned that environment being in the car. Again,
Yeah.
thinking of a car, depending on the model, some cars are much noisier than other cars. You
Right.
might have had the radio on. How loud was the radio? Does the person you're speaking to, you had mentioned they're soft-spoken. Do they have an accent? All of
Yeah.
those things are going to play a role in how your ears function in that environment.
Right. And in this case, windows were up, air was on, and there was no radio on. It's a Ford F-150. It's a truck, and it's pretty quiet inside. However, when I can't wear hearing aids in the normal hearing aids without a bunch of fancy features while I'm driving, it just makes the road noise so loud. And God
That's
forbid,
why
I
you
have my
need good
dogs with
hearing
me.
aids.
What's that?
That's why you need good hearing aids.
Yeah, absolutely. And we'll do a whole episode on that, on how people should shop for them and know what to look for. But I am convinced that he's a soft talker. But it doesn't fix my hearing just to know that, and other people need to be, aware of that. And I hope people aren't shy about asking 2 things. And I'm curious to get both your takes on this. Number one, don't be shy about asking people to repeat themselves, and even say, I even tell her, I say, I'm sorry, I have poor hearing. Can you please? I even just say that so that they know, it's not that I was ignoring you. And the other thing is, when it comes to hearing aids, toss out the vanity card. That is not especially if you have hair, it's easy to hide hearing aids. But if you're like me and they're going to show, it's like, so what would you rather have? I'd rather hear,
So
it's so frustrating.
that reminds me of a funny story. When I was early on in my career, I saw the oldest patient I had ever seen. He was 105 years old,
Oh,
and
wow.
he was wearing glasses that when you look at him straight on, the glasses were so thick that all you see are eyeballs and
Wow.
kind of look like Elmer Fudd. So while I'm talking to him, he's complaining about needing a hearing aid and says, "What are the ladies going to think?" First thing I thought, God bless him.
Right.
But
At 105.
what also stands out for me in that exchange is that people know you have hearing loss. People know if you're asking for repetition, if you're answering inappropriately, if
Such
you
good.
seem checked out from a conversation. So people know.
Sorry, what?
And if exactly. And if you have hearing aids on, maybe it cues people in that they need to speak more effectively to you and get
Yeah,
your attention when they're talking to you. So there's a lot of benefits beyond just hearing better of wearing them out in the world.
that makes sense. Yeah.
And there are certain hearing aids that, in terms of the style, they have ones that go over the ear, which people think are more visible than the ones that go in the ear. And they always say they want the ones that are in the ear, but those are not appropriate for everybody. That being said, it's a question as a professional of recommending what is audiologically best for them versus what they're most likely to wear. And
Mm,
it becomes the argument, what is the most likely hearing aid that they're going to wear rather than having it sit in the drawer for vanity reasons.
right.
And actually, in the context of this audience, I've had conversations with musicians when it comes to in-ear monitors where we talk about what do you need? What's your stage setup? What haven't you liked about past monitors? And I could sit here thinking what I think is ideal for this individual in front of me. But first and foremost, what is best for them is what they're going to wear. And then we work
Yeah.
from there.
And not, like Michelle said, keep in a drawer. That's a great point. And I notice, like, I look at people and I look at their hearing aids and I see so many different models. I see the tiny ones that go right in the ear. I've had those that are not tiny, but they're not big.
Mhm.
And of course, the over the ear ones are so slim. I've seen some what appear to be attached to this part of the
Mhm.
glasses with
Yeah.
the little tube. I'm afraid, and I need new hearing aids. We talked about that. I'm afraid, and it hadn't happened yet, but that I'll get in the shower with them. I've gotten in the shower with my glasses on. Like how water resistant are they these days? And people out in weather. Can we talk about that for just a moment? And the next episode we'll dive deep on hearing aids, and then we'll get back to the hearing health itself and hearing loss. And I have a question about that separately. But are they that susceptible to being damaged from just a rain drizzle, or what's the gauge on that?
The way we like to say it to our patients is if you're getting soaked, the hearing aids are probably also getting soaked. If you're getting lightly drizzles on, it's likely fine. That being said, we've heard it all. We've heard every possible. You've jumped in a lake, you've dropped them in a puddle, you've gone in the shower, you put them on a radiator. We've heard a lot of
Drop them
different
in the
versions.
toilet.
Drop them in the toilet. Pets eat them. So we have all of these different stories of how people can damage them. Sometimes you get good luck, and if you go in the shower, nothing happens. Other times you might go in the shower and it can damage it. There could be hearing aids are water resistant. They're not usually waterproof, though sometimes some of the manufacturers have made waterproof hearing aids. But for the ones that are water resistant, not waterproof, there is a warranty for them, so they can be fixed. Or you
Interesting.
can, if they're out of the warranty, you can always pay to fix a hearing aid that breaks. It's just a matter of being conscious of trying not to go in the shower with them.
Yeah.
But because there have been so many people that have had this experience, they have made waterproof hearing aids. I have tried them. I've put them in pools. I put them in oceans. Somehow they
Really?
still work.
Wow. What about a musician, let's say a drummer, the most active musician on the stage? Are there certain hearing aids that are more resistant? Let's say not waterproof. Let's say someone that can't afford the highest end hearing aids, but is there a style or type for a heavy sweater? So not a heavy sweater, a heavy sweater.
So typically, those sorts of factors are not dependent on the technology. It's really whether you go with a manufacturer that has a low end option or go with their high end option, you tend to not deal with physical reliability issues. You tend to deal more with differences in the computer chip of the hearing aid's features.
Mm,
So, as far as affordability goes, that's less of a factor. What I would typically recommend, and again, this depends on stage noise, time of exposure, uh, is that ear protection, or if you're on a monitor system, in-ear monitors might be better given an individual situation. However, as an aside to that, we were just having a conversation yesterday with the guitarist Tommy Emmanuel for our podcast, and he was talking about playing on stage with his hearing aids in, and he doesn't use an in-ear system. He's using on stage
wow.
wedges. And it really depends on what you play and what is the sound intensity on stage as to what our recommendation would be.
Interesting. Now, we all know that there's all sorts of supplements for blood pressure, for cholesterol. Even they say if you eat certain things, it helps maintain healthy eyesight. Is there anything for hearing that helps maintain the organs in the ears and the health that will hopefully give us more longevity for better hearing? Or is that something that hopefully someone will invent someday?
Not at this point. If you
Okay.
no, if you see it online, it's probably a scam.
It's a jar
Probably.
next to the snake oil,
Yeah.
Yes,
right?
it
Yeah,
is the
Right at
snake
the
don't
oil.
do
carnival.
it. Don't
What
do it.
we tell our patients is if your hearing's going to get worse, if it's just your genetics, meaning like the graph when you have a hearing test, the
Yeah.
how soft the sound you can hear at any given frequency. If that's going to change, that's just your body. The way you can impact it is when it comes to noise exposure, protecting your ears, because that's really the environmental factor that you have control over.
And do I remember correctly that there's no cure or maintenance for tinnitus? Is that correct? You're just stuck with it?
Oh, I thought Eric. Yeah, Eric, you
Yeah, so
answer
I'll
this one.
jump in on
You
that.
take it.
So
Okay.
as far as there's a lot of bad information when it comes to tinnitus. A lot of patients, a lot of people we encounter, they might hear from, let's say, a physician, there's nothing that can be done for it. What they really mean is there may not be a medical treatment for it. It may not be that we can give you a medication, it's going to solve the problem, or you could have a surgery and it's going to solve the problem. But there are remedies for tinnitus. There are
Oh,
management strategies for tinnitus. There are devices that can help with tinnitus. So
oh.
if you've been told there's nothing that can be done, you got bad information. So what really needs to happen is I'd recommend an evaluation with an audiologist who's well versed in tinnitus, who can really dive into that issue with you to
Mhm.
try and manage it and help you manage it.
So does the treatment vary depending on the magnitude of someone's condition in that area?
Yeah, so there are the patients that come in who have tinnitus and who would like to have it resolved, but it's not their core complaint. And if we could resolve it with a device like hearing aids, great. Then we have our tinnitus patients that are coming in not because of hearing loss. They're coming in primarily because they are so bothered by the tinnitus. And those cases require a lot more deep diving where we want to ask more questions about where and how much it affects quality of life, because depending on how severe it is, sometimes special therapy with an audiologist who specializes in what's called tinnitus retraining therapy, which trains
Oh.
works on training your brain to cope with it more. Sometimes cognitive behavioral therapy can be beneficial because for people who are coming in with such severe complaints of tinnitus that it's driving them crazy, it really is important to make it might be important for multiple professionals to be involved, not just the audiologist. Sometimes hearing aids alone are not going to resolve it.
And I've said this before, I think on our podcast in relation to tinnitus, that if a patient comes to me and says, when I drink 4 glasses of water and hop on one foot, my tinnitus is better. Can you explain that to me? I'm going to say, nope, I cannot explain that to you. But if that's working, keep doing it. That if there's some sort of placebo effect that is alleviating the tinnitus for you, as a clinician, I don't want to get in the way of that. I don't want to undermine that.
Right.
That if
Yeah.
something is working for somebody, even if I can't explain it,
Even if it's a
keep,
belief, right?
yeah, keep at it. If it is giving you relief and you feel better, go with it.
Yeah. I don't
As
hear
long as it's not destructive in some sort of way.
Well, and that's, I think, where I was about to go off the rails. I was going to say, ironically, I don't hear it when I'm playing loud music.
Oof.
Well, there's actually an explanation for that. If
Yeah, it's
that's how you
canceling
wanna
it
take
all
that.
out for one,
Yeah,
right?
it's giving your brain something else to distract you
Yeah.
from the noise. You know, my advice would be keep doing it just at a safe volume level.
Right. Interesting.
If you're playing it at a lower level, does it go away? Or is it only when you play loudly?
It is still gone when there's any other noise.
Do you have
I
tinnitus
almost
right now
never hear it.
as we're
Only in
talking?
between talking.
Yeah.
But when we're talking, like while I'm talking, I never hear it. If I'm listening to someone, I typically don't hear it. But any moment of silence and I hear it. Like now. And right there. And it varies. Like right now, I hear a specific frequency. And I've mentioned before that sometimes when I'm just awake at night because I woke up or I'm not asleep yet, I measure, I can hear and like, okay, there's like 4 octaves or 4 different layers there. And I start to dissect it. And then of course I'm going to hear it because I'm so focused on it, you know, but then as soon as if we watch a movie or I start talking with the dogs or something, is totally gone. It does not take much for it to be masked and for me to not hear it, which I like, you know.
Absolutely.
But it's so loud. Otherwise, that sometimes I'm surprised my wife doesn't say, "Hey, the ringing in your ears is loud. Turn it down." It's that loud.
We hear a lot from patients that the last people around them, do you hear that? Do you hear that? What's that sound? And it winds up being that it's their tinnitus.
Oh, wow. I mentioned on our last show, the only time I did that is when I had hearing aids in for the first time. And I said, "What's that? What's that?" And she said, "What?" I said, she said, "That's called our air conditioner." And I never heard it before.
That reminds me of a funny story when I was a kid. The first time I ever put headphones on, I was 7 years old. I was listening to Def Leppard out of a Walkman, out of a cassette Walkman. And I could not understand that other people could not hear this music. Even though it wasn't loud, just having the earphones on, I could not understand that I was the only one hearing this sound. So I think of that when people talk about hearing their tinnitus.
Yeah. Huh. And I'm curious for the viewers, whether watching live on YouTube or Facebook or watching the archive, chime in, no pun intended, chime in and tell us, do you have ringing in the ears? Do you know that you have hearing loss, or are you suspicious you have hearing loss because you're always asking people to repeat things, or you're always turning up? Like sometimes I'll be at a light and I won't have music on and someone will have their windows up and I hear just like a talk show blaring. Like I understand loud music, there's a different level of enjoyment. So, but when it's just talking and it's so loud, I'm thinking to myself, they must have hearing loss. Why would you want to hear just a voice so loud? So I'm curious for those watching if you could chime in and ask questions.
What was your cue to that you might have hearing loss that you wanted to get tested? Was there a defining moment where you said that it's time to get tested?
There was a defining moment in finally getting hearing aids. I'll get to that. But I knew because of the chronic ringing of the ears and me constantly asking people to repeat themselves. It must be me. It can't be that everyone suddenly became a soft talker. And when someone would say like, "Oh, that was loud," and I was like, well, it didn't bother me. Like maybe someone dropped something or, you know, something. But the defining, and it gradually just got so bad, so that I was spending time with Mickey Mandel, my 6th grade teacher, who's going to be 95 in December. I was with him. He wears hearing aids. And we were watching old sports shows from the 70s and 80s. And I kept asking him to repeat himself. And he muted the TV and he said, "Dan, you are doing everyone around you and yourself a disservice by not getting hearing aids. You really need to. And that was like a wake up call when he said, everyone around you a disservice, because I'm constantly, interrupting the conversation. Wait, what? What'd you say? Or I thought they said something else, and I repeat that, and they're like, no, that's not what we said. That had nothing to do with the conversation. That was a big defining moment. And if I wasn't aware, but if I had any subconscious vanity attached to whether or not to wear hearing aids, it all went out the window at that moment. It was like, I want to stop asking people to repeat themselves, and I want to hear,
Absolutely.
So, and I enjoy nature. I like being out in my garden, and I hear more birdies and things like that, and butterfly wings fluttering and stuff with the hearing aids. And it's like, wow, I can't believe what I was missing. And
Yeah.
I seriously can hear birds I did not hear before, that I can see but didn't hear them before.
Was there any difficult adjustment in getting used to hearing aids? Because it's a toss-up. I have people who come in after they try hearing aids for the first time out in the world, and they love them, and they say, I can hear the birds, and I can hear my footsteps, and I can hear the dishwasher. And then I have patients who come in who say, I can hear the birds, and I can hear the dishwasher, and I can hear my footsteps, and I don't want to. So how was your experience? It really can be, certain people want to hear those things, and other people, because it's been so long of not hearing those things, it becomes much more of an adjustment for their brain.
I found it fascinating and fascinatingly pleasing. Number one. Number two, two of my adjustments were to get it to fit where it was firm but not hurting me and not falling out. That was one. The other was dialing in the volume. My ears are not equal, as most people aren't, I'm sure, who have hearing loss, I would think. So getting just the right balance so that they sounded the same was kind of a challenge. But as far as everything being so much louder, it was just fascinating to me. It was ear opening.
Yes. And one thing we say to patients as well frequently is that the way hearing loss tends to progress over time is that it's very, very gradual. So you don't necessarily notice differences day to day, week to week, month to month, and sometimes even year to year. But you get to a point where, as I was talking about before with functional impact, where whatever the hearing loss is kind of crosses a line that you can't tolerate it anymore, or the way that you are compensating for it is no longer efficient, that it becomes time to address it. And an example of that was the beginning of COVID. We had so many people come in for hearing aids because the entire world was wearing masks. We all lip read, whether you realize it or not. We all get visual cues to be able to hear better. So for people who had hearing loss and were compensating for that hearing loss with lip reading, once you took that cue away, communication broke down, and that became a point where they decided functional impact is too great. I need to do something about it.
I get that. And there's a comment I'll put on the screen in a moment, but I get that because that made my situation even more challenging, because now not only could I not hear the cashier very well, but now they're wearing a mask. Remember when they had the plexiglass up and the mask, and it was like, good grief. Come on.
There were actually studies that were done back at that time that were evaluating how much sound attenuation was occurring, first of all, based on the types of masks, and then based on like the plexiglass types of environments. So you'd have situations certainly in medical facilities where people were wearing two masks and a face shield, and that was taking sound down significantly. So if you're having at least a 12 dB reduction of sound, it's taking speech from being audible conversational speech down to something that's more like a soft speech, loud whisper.
Or sock over the microphone type of effect. And if you have any hearing loss at all, that just compounds that challenge. Todd Remy says tinnitus here for 33 years. And I'm curious, Todd, let us know where you are, and if you don't mind, how old you are, and do you know why you have it? Do you operate a jackhammer? Are you a drummer? Are you married? Oh no, eliminate that cause. Um, I joke on
Military,
another.
that's another
Yeah,
common cause.
What's that?
Military service.
military.
Oh, absolutely, yeah.
Michelle works with a lot of veterans.
Yeah. And sometimes it can be service related, other times it's not service related, but there a lot of times we will see a difference in hearing between the time they enter the service and certainly what I'm seeing now.
Yeah, I have a friend who was a commander in an artillery unit, and of course he wears hearing aids, and he's well compared to me, he's quite a young man. He's his 30s,
Mhm.
and it's like, gosh, I probably had hearing loss at that time, but maybe not enough to have to wear hearing aids. And I say
Mhm.
probably because I started playing drums when I was just before I was 7, like 56 years ago, right now. So 56 years of that and loud
It
music,
can take its
and
toll.
yeah, a good 15 years of playing shows almost weekly, no hearing protection. Um, yeah, I'm suffering the consequences. And as Mickey pointed out, everyone around me apparently was as well. And
Yeah.
that, like, I literally felt bad the way he put it. And I felt like, okay, I'm inflicting this on other people.
Mhm.
And that's not fair. That's not right.
You know,
Um,
my mom was also an audiologist, and she used to joke that she would save more marriages than a marriage counselor.
I love that. That's funny.
There
And
are there are some hearing losses also that are overlooked because they're thought of as not significant enough to do anything about. And I would think two of those branches for that would be a mild hearing loss and people who have a unilateral hearing loss, so hearing loss only in one ear.
oh,
So hearing loss comes in degrees. So we have normal hearing, we have mild hearing loss, moderate, moderately severe, severe, and profound. So of course, as common sense, it gets worse as far the farther you go down that list. But people who have mild hearing losses very often don't do anything about it, or it's not recommended that they do anything about it because it's mild, so it probably won't have so much an effect. But it causes a lot of listening fatigue. They have to work and strain so hard to listen with such a mild loss because they could hear it, but they could just barely hear it. So
yeah.
for the people who even have more severe hearing losses, they don't even know what they're missing, as opposed to the people with mild hearing loss, where they have to almost work extra hard to get to grasp those pieces of information that they're missing.
And
That's
something I would add on that front is that a lot of physicians will say to people with mild hearing loss, like, just wait, there's nothing to do for it. And I would again reference back to the idea of functional impact. If you
mhm.
have a situation where you're experiencing functional impact from your hearing, where it's negatively impacting your quality of life, see an audiologist, find out about your options. 20 years ago, when I was doing my doctoral research and we were looking at patient satisfaction with hearing aids, we specifically excluded patients who had mild hearing loss because the way they responded to hearing aids was so skewed. One
Oh,
end would be, I really don't notice much of a difference. The other end would be, holy shit, this is life changing.
oh,
So
wow. What a
it,
difference.
yeah, it wouldn't tend to be in the middle of like, oh, this is okay. I noticed some improvement in some places. It was usually nothing or wow.
Wow, that is interesting. Is it possible to get unilateral hearing loss genetically as opposed to working 20 years with this big machine only on the left side? So it affected it. Like, can genetics cause that in just one ear or not likely?
So I would say we certainly see what we call congenital hearing loss, where somebody's born with hearing loss in only one ear.
Hmm.
Uh,
I don't think I've seen situations of it being a genetic in one ear.
we'll
Sometimes
see
it
genetic asymmetric. Sorry, didn't mean to
Yeah,
cut you off.
no, I was thinking that sometimes there are syndromes where where somebody will have a genetic syndrome where they can have hearing loss in either one ear or in both ears, and sometimes it's
Hmm.
just luck of the draw of which way it goes. I have a pair of siblings where they both have the same syndrome, but one has hearing loss in both ears, the other just in one ear. So it's just about how it presents. But I don't think I've come across a situation of it being genetic in one ear. But as Eric said, there are situations of being born with it in just one ear, and it can have either a root cause or it's just what happened with the body.
Yeah. Interesting. And John DiMatteo's chiming in from Colorado. Thanks. Let us know if you have hearing issues and if you're a musician as well. Here's just a curious question. Someone, there's pilots, but then also someone who travels a lot by air, that constant change of pressure and ears popping, can that cause hearing loss or hearing damage or ear functional damage?
So the effect of flying tends to be transient, that it'll come and then it'll go. Could be longer lasting if you fly with significant congestion or a cold, something like that. Some people have something called eustachian tube dysfunction, which is a tube that connects your middle ear and the back of the throat. And when you pop your ears, when you hold your nose and blow, when you feel your ear open up, that's forcing air through that eustachian tube. So when you're on a plane and you feel the pressure in your ear, it's because that tube cannot function efficiently enough to regulate pressure. So when you're going up or when you're coming down, that change in altitude is occurring too quickly for your ear to regulate that. That's why you have to force that air through that space. It's unlikely that there's going to be any permanent effect of it. There's certainly are instances where the pressure was so great that somebody's eardrum could rupture, and then depending on how that heals, there could be effect. But that's kind of getting into the weeds of what can happen. The general effect from flying on hearing is temporary.
What I would also add to that is that there are some people we've seen come in with complaints where they were feeling pretty okay, maybe something a little bit on the horizon of symptoms. Then they went on a plane and now they feel it so much worse. And our explanation for that is that there could have been something, either a clog sensation or tinnitus or hearing loss, that was pre-existing. And then there was this event, and you can substitute event of flying for something else, any sort of major life change or travel that then afterwards, that marker made those symptoms more noticeable. So even though the symptoms were already there, it could have been exacerbated, or even in just the mind, there's been a change in mindset that now those symptoms are much more noticeable, and that's what's bringing them in.
That's interesting. Yeah, because just thinking of, okay, something's definitely going on there. So I wondered if it had much of, any sort of effect. A lot of musicians travel, a lot of business people travel, things like that. Thanks for that. Because I remember flying once. I had a head cold. It just happened to work out that way wonderfully. I had a head cold, and it felt like knitting needles were going into my ears, the pressure with the congestion. It was so bad.
We get asked a lot about what there is possibly to do because people then get anxious about going on planes because they don't want to feel that extreme pressure. So I think the best advice we can give, Eric, correct me if you have anything different. We say you can hold your nose and blow as multiple times just to keep that tube opening as much as it can. People have certainly thought of chewing gum just to kind of make sure that tube is opening and closing, swallowing. Eric, do you have what do you recommend for patients when they come in and are afraid to fly?
You can also talk with your physician about potential medications. There are certain nasal sprays that might be used to reduce inflammation, to dry up congestion. Those are some ideas that we see recommended from physicians sometimes, but I would advise anybody listening, consult with your physician if you find that gum chewing, swallowing is not sufficient to manage the discomfort of the pressure changes on a plane.
What about smoking a joint in the bathroom of the plane to just relax a little bit?
I think that goes against airplane policy.
When the federal marshals come on the plane to take you into custody, you can decide if the effects of the THC are worth the years in federal prison.
Yeah, folks, you got to take care of your ears. And on the next episode, we're going to talk about how to shop for hearing aids and the different things to look for. And the episode after that, we'll get deep into ear cleaning and wax and things like that. However, you folks watching are always welcome to ask questions. We're not going to say wait till 3 episodes from now. We're going to cover that. We'll always answer I'll always take the questions. Doctors Michelle and Eric will answer the questions. Anything else on this topic before we go?
I think we'll wait to see what questions people have.
Great. All right. Thanks, everybody, so much for tuning in. Thanks for following us on Drum Talk TV and Doctors Michelle and Eric here on Plugged Into Hearing Health. And we'll see you all again soon. Thanks, everybody. Hopefully they heard